Hello, and welcome to Central New York Diabetes Education at the Mohawk Valley Health System. I'm Caroline Jacobus, a registered nurse, certified diabetes educator, and foot care nurse. Many of our patients learn that checking the skin of their feet daily is really important when you have diabetes, but they don't understand exactly why or how to perform the exam. So today, we're going to show you a few simple steps to help keep your feet healthy for a long time. Diabetes is really a disease of circulation, and your feet are one of the farthest parts from your heart, and often the first place you can experience something like poor feeling or slow healing. Diabetes is the #1 leading cause of foot and toe amputation in the United States. So these simple steps that you learn today will help to avoid complications later on. And now for the first step, we'll need to remove our shoes and socks, and you can follow along with me. We're going to remove our shoes and socks next, and I'm going to demonstrate just using one of my own feet. So if you're going to check both of your feet, you'll repeat what we're doing twice. So I'm going to take off my shoe and my sock. And the first thing we're going to do is actually take a look at the top of our feet. So you're really looking for any redness, pressure points from any shoes. We'll look at the top. We'll look at both sides of the feet and any broken skin. You can see on the side of my feet I have some extra redness here. This is something called a tailor's bunion, and we'll talk about that maybe in a different video segment. But this creates pressure in my shoe, and therefore there's extra redness there. So this would be an area that I would want to keep close watch on. It could lead to a callus formation or a blister or something more serious. We also want to look at the tips of each of our toes, because if we're wearing shoes that are maybe slightly too small, you can get a lot of extra pressure here. You can form calluses at the tips of your toes, or maybe if you're cutting your own toenails, you cut one too short and you may have clipped your skin. So that would be an area we'd be particularly concerned about getting infected. And we want to observe these areas every day. And if you have any cuts or breaks in the skin, you want to notify your provider. The second place we're going to look is next in between our toes. So we're going to take our feet and we're going to pull apart our toes, and we're going to look in between each one. In between the toes is an especially significant area where moisture can accumulate. So, for example, if you get out of the bath or shower and maybe you forget to clean or wipe and dry in between each one of your toes, that area can stay wet and it becomes a breeding ground for fungus. The other thing that wet in between your toes can create is something called maceration, and that means that over time your skin can get really soft and moist. And as your feet are moving back and forth in your shoes, that area can split and it becomes a portal of entry for bacteria. So if you're looking in between your toes and you see any split skin or peeling skin, that is also something that I would report to the provider, because we don't want to invite bacteria into our circulation. The next thing we're going to do is look at the bottom of the feet. And for some people that means turning their foot, putting it up towards your knee or your thigh and turning it and looking at the bottom. But for other people who are unable to really perform this kind of maneuver, you could use something like a mirror. So this mirror I purchased in the dollar store. Very simple, easy to use. I could actually put it down on the floor, and I could put my foot over the top of it to be able to see the bottom of my feet independently and not have to ask anybody else to help me. This is a really easy way to be able to make sure the bottom of your feet and the skin is intact, or it's smooth and looking good. Other adaptive tools that you can get, I also purchased this in the dollar store. This actually is a mirror that's on a telescoping handle. And what it does, there's two sides to it. There's a magnification side and a normal mirror. Is I could sit in my chair and just simply make the wand longer so that I could see the bottom of my feet very easily, and I could really see some detail if I turn it to the magnification side. So don't ever feel like you can't see the skin of your own feet without having somebody help you, because there are some very simple steps you can do to make sure that you're able to see them yourself. So getting back to the bottom of the feet, we're looking for similar things here. We're looking for any color changes, pressure points from your shoes. Also, any dry or cracked feet. We're worried about anything that cracks because it could be a portal of entry for some sort of bacteria to be able to get into the skin. So we want to make sure the feet are smooth, they're not excessively dry or cracked, you don't have a lot of big calluses, and certainly there's no cuts because maybe we were walking barefoot and stepped on something. So that really sums up how we want to look at the skin of our feet. And before we wrap up today, we're actually going to talk about something called monofilament testing. So finally today, we're going to talk a little bit about monofilament testing and why it's actually done. Every year, you would expect one of your providers to conduct a monofilament test, and it's something that allows them to understand if you're losing something called protective sensation. Protective sensation does not mean numb feet. It means if you lose protective sensation, that you don't feel things as well as you normally did. And I'm going to give you an example. Let's say you were walking barefoot, although I'm not recommending you walk barefoot when you have diabetes. That's actually not recommended. But let's say for the purposes of this example, you were walking barefoot and you stepped on something that was a little bit sharp. You would expect, if you had complete sensation in your feet, that the minute you felt something touch your skin, you would pull away. When you have loss of protective sensation, it means that when you step down on something, it needs to break the skin before you even notice it's there. So that's why it's so important to know if you have loss of protective sensation, and it's usually done once a year for someone who has diabetes. To do a sensation exam, and I'm going to use my plastic foot to demonstrate this, and a monofilament. A monofilament is not a pin, it's not sharp. It's actually a nylon thread, and it bends back and forth. There's 7 or 8 different places that your provider or your foot care nurse would check the skin of your feet, and they'll ask you to close your eyes or turn your head so you can't anticipate when it's about to touch you. And what we would do is we would start first on the toes. So we would touch to each and every toe, then we would move to the ball of the foot, also the arch of the foot, and then the heel. So we would touch various different places, usually up to about 8 different points in all of these areas to determine if you're losing protective sensation everywhere or just in one particular spot. And when you're touched with this nylon thread, it's designed so that when it bends, that's the actual threshold where you should be feeling something touch your foot. So we can appreciate that if we lose that very fine sensation, it is possible that something would have to break the skin before we know it's there. And we know that we don't want to provide any portal of entry for bacteria or have a slow healing wound. So that's the value of having this test done every year. And I always encourage people, when you see your provider once a year, make sure you take off your shoes and socks before they even come into the exam room and have a discussion about your feet, monofilament testing, and learn if you're starting to lose protective sensation so you can take best care of your feet. And obviously you want to look every day, because in those situations you're more likely to see the problem before you feel the problem. If you have any questions about anything we've discussed today, or if you just want to learn more about diabetes education, please go to our website, mvhealthsystem.org/diabetes.